anatomy, physics, physiology, all that stuff. So we'll talk about that now. Okay. So part one, general systemic and skeletal anatomy and arthrology. I'm going to be flying through this rather quickly because, again, the assumption is you guys have already had this, right? So we're just going to kind of touch upon it before I start talking about radiographic positioning and terminology. But again, this is just a brief lecture on anatomy. Every time we cover a unit, we get into more of the specifics and becomes more detailed. Okay, so again, this is just a basic background. So when we're talking about anatomical structures, you have a beginning and the end. You got the most basics, which is your atoms. Similar atoms forms a molecule. Similar molecules forms a cell. Cells of the cell same function forms a tissue. Same tissues forms an organ, and then organs of similar type of responsibilities issue the system. And our body has 10 different systems, which we will be covering throughout the course of anatomical positioning. So we got the first part, next semester will be the second part. The skeletal system comprises of 206 separate bones. The function of the skeletal system is to support and protect the body, allow movement by interacting with muscles. The long bones especially are responsible for producing blood cells found in the marrow, and is also a source of storing calcium. The circulatory system, there are two different types. We have the system which regulates blood flow. Okay, the whole purpose of the circulatory system is to what? Yeah, to circulate. Okay, it's to nourish our vital tissues and organs. Okay, the blood carries different nutrients to the sites, but it's also the same passageway to deliver oxygen to these vital tissues and organs. Now, the lymphatic system is also part of the circulatory system. The lymphatics is responsible for your immunity, more responsible for carrying the white blood cells to help cure any type of infections. But it's also part of the blood circulatory system because it provides a pathway for any type of overabundance of blood supply. Okay. Then we have our digestive system. We will be scratching on the surface of this in this particular semester, but we are going to delve heavier into it in the next semester. When we're talking about x-rays, we know what about x-rays is that when you're looking at a radiographic image, the structures or anatomy that sticks out are bony anatomy, right? Bone is obvious on an x-ray. They appear as white. Now, when we're taking x-rays of different anatomical structures that don't have the same density as bone, we need to introduce some sort of contrast agent. Okay? When we get into the digestive system, we're talking about the ingestion of contrast agents or introduction of contrast agents vascularly to different anatomical structures, because when you do that, it gives it the same type of density as bone. Okay? So we'll talk about that later on. But the digestive system, to better visualize the digestive system, we need to introduce some kind of contrast agent to outline, okay, the alimentary canal, okay, which is your esophagus, your stomach, your small and large bowel. Okay, and you also have the different accessory organs of the digestive system. That is necessary to introduce a contrast agent to delineate it from the rest of the anatomical and surrounding structures. So the whole purpose of the digestive system is for absorption and absorption of the nutrients and elimination of any waste products. And then you have your respiratory, which should go along with your circulatory system because the oxygen is delivered by way of the circulatory system to the vital tissues and organs. So respiratory system supplies oxygen and also eliminates carbon dioxide by the process of respiration. Bless you.
Like,
Yes, urinary system, okay? What's the whole purpose of the urinary system?
Get rid of waste products.
Okay, waste products from what?
From your kidneys.
From your blood, right? So eventually, your blood supply makes its way into the urinary system. The kidneys is what filters out any waste products and produces urine, and we get rid of these waste products by way of urination. Okay? So it regulates blood and also eliminates waste products. A reproductive organ, male versus female. Do we do any type of reproductive procedures in x-rays? We actually do. Okay, have you guys heard of a hysterosalpingogram? Hysterosalpingogram, okay? It's a radiographic study of the female reproductive organs. So it is something that we do in radiology. We have a female patient coming in who may not be able to bear children, so a doctor may order a hysterosalpingogram where we would access the fallopian tubes, inject contrast into that system to look at the vessels to see if there's any type of kinks that's preventing them to bear a child. It's a very sensitive type of procedure, generally done with female technologists, of course, right? And it serves both as diagnostic and therapeutic, because while they're pushing contrast into the vessel, it straightens out the kink, okay? And we've talked about this also in the past, that I want to take away the misconception of what radiology does. Many of the things that we do in radiology now is not just simply diagnostic, but we perform many interventional and therapeutic type of procedures now that we've taken away from other departments like outpatient surgery. We now do it in radiology and we fix patients. Okay, nervous and muscular system. We don't do a lot of these type of procedures that involve the nervous or muscular system. Okay, but the nervous system regulates body activities. The muscular system allows for movement, skeletal muscles, as well as your internal organs and cardiac type of muscles. And then you have your endocrine and integumentary systems. The endocrine system is a ductless system that regulates the hormones. I put this little blurb down here. Do you guys have this on your slides? You don't even have access to your slides yet, right? Okay. Anyways, a collection of glands that produce hormones that regulate metabolism, growth and development, tissue function, sexual function, reproduction, sleep, and mood, among other things, is the responsibility of the endocrine system. The integumentary system, talking about the skin. We're also talking about the lining of your visceral organs, protects the body and eliminates waste through perspiration. Okay. Axial and appendicular skeleton. Again, we said that the number of bones for adults is 206. Now, as a child, do we have 206? We have a little bit more, okay? So, for example, one would be that of the skull, the sacrum. The sacrum grows in different pieces. The coccyx, their tailbone grows and begins with many pieces. And as you get older, those bones fuse together. So as a child, growing into adolescence, then we will reach that 206 separate bones, okay? So the skeletal system is broken up into two different parts. We have the axial skeleton, which is the central axis of the body, including the skull, the vertebral column, the ribs, and the sternum. The appendicular skeleton refers to the appendages in your limbs. This also includes your shoulder and your pelvic girdle. Again, we're just scratching the surface. Once we get into the different units, we spend a little bit more time on the specifics. Okay, so this is just a brief introduction. All right, classification of bones. Large bones. Talking about the long bones, including like your humerus, for example, your tibia fibia, your femur. The classification can even be broken down into more specifics of the anatomy of the long bones. On the very outside exterior is the compact or the dense bone. Within the inside is your spongy bone, and then you have your connective tissue surrounding the bone that kind of binds everything together is your periosteum. Then we have your short and flat bones, including your carpal bones. What are your carpal bones?
Hand bone.
Okay, your wrist. Okay, that's your wrist. And the tarsal bones. Those are the bones of what? Your feet. Okay. Then we have the bony calvarium. Calvarium and skull often, those terms often get mixed, but calvarium is talking about your skull cap. When we're talking about skull, it's usually the skull cap and the facial bones. They're usually all included. So calvarium, we're talking about your skull cap, then your sternum, and then your ribs, and then scapula. That's your shoulder blade, right? Shoulder blade. So the scapula is a very interesting anatomy. It's one of the most difficult type of anatomy to take an x-ray of. It's not simply front to back or side to side. You will come to learn that because we are three-dimensional, we try to get the anatomical structures in true profile, whether it be flat like this or on its side. And you gotta have an understanding of tube angulations and body positioning to get the true profile of that particular anatomy. The scapula is one of those that are very difficult to get a true lateral of. Okay, because some of us are really burly and some of us are very skinny, and the degree of rotation is based on body habitus. You should be able to recognize your patient and say, oh, okay, I need to rotate my patient 30 degrees from a true AP, or 15 degrees from a true PA. So I'm throwing out the lingo out there now because I want you guys to get used to the terminology. Irregular bones, oddly shaped bones, includes your vertebrae, your face, and also the pelvic bone. All right, any questions so far? Bone development happens in two different places. Primarily, it happens at the shaft of the diaphysis of the long bone. And then at the ends of the bones is where you're going to find your epiphysis. Or particularly, the epiphyseal plate or the growth plate is where some of this bony growth occurs. All right, so if we were to look at like an x-ray like this, okay, I know for an instant, because you guys don't recognize this yet, but you will eventually, I will know in an instant that this is a young patient. Why? What is the giveaway?
You can still see the plate.
The epiphyseal plate. So you're looking at this, and if you don't have your x-ray eyes, the first thing you're going to say is, ooh, there's a fracture. It's not a fracture, it's the plate. And the way they look is you'll see two separate bones with a space in between. Okay? But that's actually the growth plate. And you will see that often in children. So when you're taking x-rays of children, one of the first things you're going to look for is this bony plate. Okay? Well, this is an x-ray of, by the way. It's an x-ray of the knee, right? So you've got the femur at the top, you've got your tibia right here, and this is the fibula. See this see the two separations there too, the top of the fibula? Looks like there's a chip on there, but that's actually the epiphysis and the plate separating the two bones. It's a pretty young child, right? And you're not really seeing the patella yet. It's very hard to see, but it's there somewhere. We're going to train your eyes when you're looking at an x-ray, because we always say this. You know, it's like going to a museum and looking at a painting and not appreciating the art because you don't know exactly what it is that you're looking at or what you're looking for. Okay, that's what's going to happen when you're looking at an x-ray. It just looks like an x-ray, but when you start learning how to look at an x-ray, you start to see all those very fine details. And to see those fine details is trying to differentiate the overall density and the different contrasts of those images. As a radiographer, okay, we deal with a palette of grays. An artist has a multitude of colors to paint a picture. Us, we deal with black and white and all the different shades of grays in between. And each of those different grays represents an anatomical structure from being very soft to very thick and dense. And pretty soon when you're looking at an x-ray, if I was to put up in an abdomen, the obvious is you're gonna see the lumbar spine and the pelvis, but when you're looking at an abdomen x-ray, just based on the different variations of the grays, you'll be able to see the liver shadow, the kidneys, the ureters, the urinary bladder, and you may also see the outline of the large intestine and the small intestine, just by looking at the different shades of grays. Okay, classification of joints. Arthrology. So I'm just going to introduce this now. I'm not going to spend too much time on it, but we'll spend some time on it later on. The classification of joints, the articulation of bones. Okay, that's what we mean about joints. We're talking about the articulation. Okay, joint movement. They're broken down by different categories. We used to do it by way of function. What was the function of that particular joint? It was either synovial. Okay, synovial means immovable, and a good example of an immovable joint are the sutures of your skull cap. Okay, because your skull cap is composed of several bones. It's not one large bone, it's composed of several bones, and they're held together by a fibrous type of can't even talk now, fibrous tissue. You guys also know me that if I don't eat, I start to stutter, right? And I haven't eaten, and I'm getting hungry. Did you guys bring my supply of Snickers bars? No? Okay. I'm getting hangry. Okay. The other one here is the ampiathorial, which means limited movement. So it does move a little bit. It's not tight, and it doesn't really move as a diarthrodial type of joint, which is also considered synovial. Synovial is a good example of a synovial joint would be that is freely movable, like your shoulder, like your knee. Okay. Cartilaginous. Okay. How do you guys say? Do you say duodenum or duodenum? Okay. Cartilaginous. Okay, held together by cartilage and then fibrous structure. This is the old way of classifying. This is the new way of classifying. Depends on the school of thought. Okay, we will discuss both function as well as structure type of classification of the joints. Okay, so here are some examples of a fibrous joint. There are 3 types. Syndesmosis, okay, it's an ampiathorial type that's slightly movable. Your sutures on the skull, the teeth, okay, a gompus type of joint there with the teeth and the gums and the bone. Then some examples of a cartilaginous joint includes the vertebral column, and then parts of the knee. Synovial, talking about an encapsulated joint that contains the synovial fluid that allows free movement. The synovial fluid is kind of a milky type of fluid that promotes a smooth, friction-free type of movement in the joints. By the way, we also do studies of the joints called arthrography, where we take a long spinal needle, we stick it in between joints, and we fill this capsule up with contrast. Yeah, I'm looking at someone grimacing back there. Does that sound painful? It is painful for the patient. But again, these are things that we do in radiology. Again, misconception, we're not just taking pictures, guys. You are involved in procedures in the department. They may require needles, It may require knives, it may require plastic tubes, among other things. Okay? An arthrogram is what we do. We take a long spinal needle, stick it in a joint, and we inject contrast in there to visualize the joint capsule to see if it's been ruptured. Okay? So here are your synovial joints. Movement types includes a plane type of movement, okay, a hinge type of movement, okay, plane or gliding or ginglymus or hinge type. We got the pivoting type of synovial joint. Good example of that would be your forearm and your humerus. Look what your arm can do. Pretty cool, right? Same thing is also with your neck. Allows you to pivot. That's, so you have your pivotal and you also have your ellipsoidal type of joint. One is concave, the other one is convex. Okay. Same type of neck here with the saddle. One is convex, the other one is concaved. There's only certain areas where you have a saddle joint. It looks just like a saddle on a horse. Usually find that on your thumb joint. And then you have your ball and socket joint, which includes the hip joint and the shoulder joint. Okay? Again, we'll get into the specifics later on. All right. Let me get on my phone real quick, okay? I need to let them know it is hotter than, what's hotter, mercury? Are you guys doing okay, or is it just me that's hot?
Good.
Really?
It's just you.
Are you guys serious?
It ain't that bad.
Even though you're hungry, you're hot.
I'm sweating. Okay.
Bar.
What's that?
Maybe that's why you're so hungry. You're burning too many calories right now. You're too hot.
Very could be, I don't know. Honestly, I wanted to come in shorts today.
Are you not allowed to?
It's one of those double standards. You know what I mean? Yeah, women can come in skirts, but you can't come in shorts. Now, if I came in a skirt, maybe they'd allow me.
You just be from Scotland.
Yeah.
We have Asians there.
Yes. Now, is it true that the Scottish, when they wear the kilts, they don't wear underwear?
Yes,
Is that true?
I've heard.
Really? Oh, I should be Scottish. Okay. All right, let's talk about positioning terminology. Okay, so now we're going to be using terms from now until forever. These are the terms that we're going to be using, okay? All right, so general terms, radiography. Radiography is the production of a radiographic image. Now, and this is really cool, but up until last week, did Ms. Mintz take you to the new room? Have you seen the room yet? Room 309, as long as I've known it, had a wall that separated the dark room from the instructional room, okay, instruction room. And now it's gone. And it's crazy for me to say that because I felt like I've lost my best friend. We've been using film for, again, as long as I can remember. And it wasn't only as recent as maybe 2 years ago that we completely went digital in our facilities. We only had one facility that was still using film. All the other facilities that we were affiliated with were using digital. And I was contesting that, you know, we kept going back and forth, should we keep the processor, should we keep the processor? And I was like, I didn't want to let go of it because it's hard to teach theory if there's nothing to show you guys. Film was a good example of that anytime there were changes in your technical factors, when I mean technical factors, your KV, your mass, your distances, okay, anytime there was a change or variation in those factors, you can also see it radiographically. Now, when you have an error, if you make a mistake, or if there's some kind of slight nuance in the technical factors that you select, you can't see it on your image anymore because the computer has algorithms to correct your image, and it looks great every single time. You guys remember that, 146? Okay, so when we gutted out that room, I wasn't on campus. I was actually in Disneyland with my girlfriend, and Miss Smith, I want to call her Lynn, Miss Smith sent me a picture of the truck as the processor was being loaded in the back. And I wrote back,
Go
and she
edit.
sends me an emoji with her laughing, right? I'm like, yeah, because I had a really hard time letting go. Even our film files. As we were clearing up our film files in the back, you saw our cabinets with stocks and stocks of film and studies. So I came here during the summer when we were dismantling the film file and also putting all the films together. And we were putting them in the stack. And you guys remember when your parents told you to clear your room or clean up your room or get rid of stuff in your room? What were you actually doing?
Trying to hide
Moving it
You
from
were,
one place
yeah,
to
exactly.
another.
You were hiding stuff. So that's what I was doing. We were trying to get rid of it, but every time I went to the film file, I would sneak it to the side and put it on the side. She goes, "What are you doing?" I said, "I can't let go." I said, "What if I need these?" So actually, I have a stack of those old film files in the closet, and the rest we got rid of. But it was like, oh, what are we
She
gonna
told us
do?
your stack was like this tall.
No, it was.
She threw it away Monday.
She what?
She threw it away Monday.
She did?
Just kidding.
I know. So now what I'm gonna say is you guys are spoiled. Because now you guys are working with modern technology. And with modern technology, you have the computer that always produces a nice image for you guys. But the downfall for that is sometimes we get careless and lazy and we're not looking at the technical factors that we are using to produce these radiographic images, right? And what I had said before, anytime you manipulate those factors, what else are you manipulating?
The amount of radiation.
Exposure. So you can unknowingly give your patients a blast. When I looked at it film, I knew if I over or underexposed my patient just by looking at my x-rays. Now you can't do that with digital imaging. Everything looks great. But we're going to teach you guys ways of how to recognize whether or not you over or underexpose your patients, okay? So anyways, going back to what I was saying, radiograph is a production of a radiographic image. Now we're going to try to focus on digital imaging and not mention the film or chemical processing part of it as much. Okay, the radiographic image is a representation of the patient's anatomic structure. Okay, radiographic image. Now, the proper way that applies now in the present is radiographic image. Okay. We try not to say radiograph anymore because radiograph is actually a hard copy of the study that you did. It's a hard copy. It's a radiograph. But now we're looking at the image, the study that you did, on some kind of display screen. So the proper use for that is image and not radiograph. Now, are they going to be used interchangeably when you guys get out in the field? Yes. Okay, they will be. Okay, and you'll still hear people saying, okay, here is an X-ray of, or here's a radiograph of, here's an image of. So those terms are going to be used interchangeably. Okay, but they do have each a specific meaning. All right, so here we have radiograph versus X-ray film. Radiograph refers to film and image, and we'll talk about the nuances again later on throughout the program. The radiographic examination consists of positioning the body or part to the central ray. Okay, what's the central ray? What do we mean by the central ray?
The middle.
Okay, so well the beams, okay, and you guys know when X-ray is produced, right? Does the beam come out in a straight fashion
No.
like this? It comes in a what? In a divergence, okay, in a divergence. The very center of that beam is where you have 100% intensity. Do you guys remember the Anatomical effect? See, I'm bringing back stuff that you guys learned, what, 3 years ago? The anode-heel effect. The beam intensities varies from the cathode end to the anode end. Okay? It's called the anode-heel effect in that the cathode end of the X-ray beam is going to be greater than 100%, whereas the anode end is going to be less than 100%. So where you have 100% intensity of that beam is in the center, therefore it's called the central ray. Okay? And it's that central ray with the use of light and crosshairs. We direct that central ray into the most thickest part of the anatomical structure when we're taking an X-ray.